Hi, this is Shelley Kraft. We're coming to you live on SNNLive. We're at the LD Micro Invitational in Bel Air, California, 2014. I have with me Michael Oliver of SpectraScience. It's a publicly traded company, symbol SCIE. Mike, welcome back to SNNLive.
Shelley, thank you very much for having us.
Now tell our audience a brief overview of the company, and then we'll get an update.
Great. SpectraScience performs what are called optical biopsies. The traditional biopsy is cutting out tissue, sending it to a pathology lab, and having a doctor or technician look at it to see if it might be cancerous. What we do is we shine light on human tissue. We can make the diagnostic decision whether or not that tissue is potentially cancerous or not without removing it from the body, and we do it in about 1 second.
Now, that goes beyond skin. You're talking about internal organs as well.
I am indeed. Our first indication is in the screening of small polyps and lesions during screening colonoscopies. But we can do the technology in the lung, in the upper GI, in the lower GI, and in other organ systems throughout the body.
Now, when you go into the market, who's your customer for it? Is it the doctor, the hospital, or all of the above?
Well, it's generally all of the above. The doctors want to know that it works, and you have to have the clinical proof that your product works and works well and was very reliable. And indeed, our product in the colon, in the lower GI, as measured by a statistical measure called negative predictive value, is at 96%. By the way, the threshold is 90% or above. The hospitals, however, also want to know that the product and the technology you're providing is less expensive than what they're currently doing.
Let's talk reimbursement.
Well, we're really focused right now in capitated systems in Europe. So reimbursement is a slightly different issue. It isn't so much about reimbursement and whether they decide how much they're going to pay a doctor for it, because doctors in capitated systems are salaried employees. So in that case, it's really about reducing the total cost of healthcare. And what we do is replace those very dangerous, those expensive physical pathologies with something that is safer for the patient, faster for the clinician, and less expensive for the healthcare system.
For more information, what's your website?
www.SpectraScience, SpectraScience.com.
Ladies and gentlemen, Michael Oliver, SpectraScience, a publicly traded company, symbol is SCIE. I'm Shelley Kraft, this is SNNLive, and we're at the LD Micro Invitational in Bel Air, California, 2014. Mike, always a pleasure to see you.
Thank you, Shelley.
Thanks for coming on.